A hurricane ravages a coastal community. Hurricane Irma, U.S. Virgin Islands, September 6, 2017. Michelle S. Davis, Ph.D., Commissioner, Department of Health, USVI.
It was very frightening at first. We didn't know how strong the hurricane would become. And then Hurricane Irma that landed on September 6th was a Category 5. And then 2 weeks later, Hurricane Maria, another Category 5. There was a lot of damage, of course, from both hurricanes. And it was difficult to try to figure out what to do, even though we had plans, because we did not expect the type of devastation that had occurred throughout the entire territory.
A weather radar shows the swirling weather system. Floodwaters engulf cars and low-lying buildings. Boats pile atop each other in a marina, and rebar pokes out from crumbling structures. Amy Helene Schnall, MPH, epidemiologist, CDC.
After a hurricane or tornadoes or a major storm impacts an area, there are a lot of unknowns that the Department of Health and leadership don't know about. And so a CASPER was designed to go into the community and quickly gather information about that community's needs.
CASPER workers walk through a neighborhood with clipboards and other documents and speak to residents. Esther M. Ellis, Ph.D., Territorial Epidemiologist, USVI DOH.
The acronym really does tell you what a CASPER is, and it stands for Community Assessment, Public Health, Emergency Response. So we're surveying the public, that makes sense, and then the public health emergency, in this case, were 2 Cat 5 hurricanes. And public health response is what has been done, where is the community at now, and what still needs to be done.
A resident talks with a worker. Subtitles. There's water. There was water all up in the whole house. They only had to put everything out because of the mold, and all the water keep coming in before I get the tarp up. But since we have the tarp holding up, everything is going okay.
Great. That's really good to hear.
More CASPER workers question residents sitting on their porch.
Yeah, we had mosquitoes after the hurricane but now they just not much.
Captain Joseph J. Roth, MPH, CDC Career Epidemiology Field Officer, USVI DOH.
At its core, CASPER is really about knocking on doors and interviewing members of the household about what their needs are. To do that, we need some consistency and we need some systematic way of selecting which households.
In a classroom, CASPER workers and trainers gather to review information and put together field packs.
We come up with our objectives, our sampling frame, our questionnaire, and once we're done with all that preparation, we go into the field and we do a just-in-time training for the team members. And this covers things like logistics, safety. The teams will then go out into the field that afternoon and potentially the next day for about 10 hours of data collection. Once data is collected, we have about a day to analyze it, interpret it, write a report, and get it to the community leaders. And that way, the information is used right away.
The CASPER team works on laptops, then reviews documents in a classroom. Ty Hunt Caesar, MD, MSPH, Chief Medical Officer, USVI DOH.
The data that we get from CASPER, we spread through many different departments. Our preparedness department, our epidemiology department, our maternal child and health departments, including our women, infants, and children's departments, are able to get the data that we need so that we can arm the public with knowledge and with equipment.
And this CASPER that we're doing now is 6 months post-hurricane. The main issue that appears to be happening right now is mental health and some post-traumatic stress. Once we analyze the data, then we can do targeted response or recovery efforts to manage that or help improve that.
Other conditions that we need to be concerned with are the areas in vector-borne diseases or mosquito-borne illnesses. We have emerging infections that we're seeing in our territory that will continue to increase, especially with the environment after the storm and limitations in places where we can actually provide vector control.
So it's a really quick and inexpensive, it's a very flexible tool. It was designed for after disaster use, but really has broadened a lot more.
A map of the United States appears with the list for the territories of U.S. Virgin Islands, American Samoa, Guam, Northern Mariana Islands, and Puerto Rico. CASPER, Community Assessment for Public Health Emergency Response. Cities and states across the country have used CASPER to conduct rapid needs assessments. 28 states light up, along with the U.S. Virgin Islands, American Samoa, and Puerto Rico.
So you can use a CASPER for the response efforts. You can use it for recovery efforts. You can use CASPERs to prepare for an emergency, see how the community is.
A CASPER is really a locally driven endeavor. It's simply a matter of federal partners bringing in some expertise and some information to empower and enable the local health department to perform the CASPER independently.
Nicole Tyson, Director of Public Relations, USVI DOH.
CDC has been a major partner for our operation and building capacity. We really appreciate them because a lot of work that I have done, I wouldn't have been able to be as effective without their assistance and support.
A flyer reads, "Protect yourself and your family after hurricanes. Use bottled water for drinking, cooking, and brushing teeth. Be safe while cleaning up. Protect yourself from mosquitoes. Keep your hands clean to prevent the spread of germs." Jacqueline Greenidge Payne, Acting Territorial Coordinator EMS, USVI DOH.
And this program, going out there and listening to the pulse of the community, hearing what they say, and bringing it back to us as the lead healthcare agency. Whatever we can do, we're there. We're responsible for the community, and that's what we're doing.
An aerial view travels along the coastline. Logos appear: Department of Health and Human Services and CDC. For more information, visit www.cdc.gov/nceh/HSB/disaster/CASPER.